Hi, I just want to thank you for joining us and letting me share a few topics this evening. First, I just kind of want to visit with you a little bit of why we're open and some of the precautions that we've taken in the clinic. And then lastly, want to kind of, probably the most thing I'll take the most time about is I want to discuss something about is why we need to take a deep breath. So first of all, the first thing is, why are we open at the Global Wellness Clinic? And, the easy thing to do would have not been open at this point in time. But I got to tell you, the staff has done a wonderful job, and because at a time of crisis like this, you have one of four options. You can do nothing, you can retreat, you can take average action, or you can take massive action. And the staff, because of the circumstance, what it took to get to where we are, after doing practice 32 years one way, to after numerous webinars and conference calls and getting information on a daily basis, and it's dynamic and it's changing, to come to the staff and our team and tell them, hey, this is what we're doing, this is what we should do, and have it implemented in such a timely manner and change everything we've done for 30 years of practice is amazing to me. So just want to say hats off to the team at the clinic for what they've done at this point. So first of all, why are we open? The Federation of Chiropractic Licensing Board states that doctors of chiropractic are essential healthcare providers ready to serve their communities both in a daily and in times of urgent need. Chiropractic is considered an essential treatment of neuromusculoskeletal conditions. By seeing their chiropractor, patients will not back up emergency departments with complaints that respond to chiropractic, and therefore preserve limited life-saving personnel and resources when they are both in critical need. Just recently, last Monday, we had a young man with a broken foot. There's a great example that they didn't have to go to the emergency room or to a clinical setting where there might be higher risks. So we're excited about being able to provide those services for our community and our patients. Just the other night, we had another person that had a bad case of gout that we're able to take a look at and give them the direction and the recommendation they need to do with their primary care provider. So we're happy that we're able to provide that service and had the team that was able to put together so we can continue under the guidelines practicing and create a safe environment for our patients. Probably the most important thing, and that's for me, is that the chiropractic philosophy and the reason I want to be open and to help people. And the fact that our team, why they're there and providing and offering care for patients, is because, let's go back with you a little bit. Chiropractic was founded in 1895. It was not founded on the idea of back pain or headaches. It was not about that. It was about people were going to chiropractors as a new way of healthcare, a way that they understood that the nervous system controls every tissue in the human body, and that the body is self-limiting, self-regulating, and that we just need to give it an opportunity. And so there were people going in groves to chiropractors at that time, not for back pain, but for a wellness model. Come along just a little bit from the opening of when they became a profession, they came along the Spanish flu of 1918. And during that time, millions of people passed away. Of course, hygiene had a big part of that, amongst other things. But one thing that was interesting, the people that were getting regular chiropractic adjustments still got sick. However, the finding that we're seeing is that the death rate was so much decreased in that population. So much so that our profession started getting licensures, and that was kind of the forefront of us getting licensure and becoming a profession. Not saying we cure and prevent everything, but moving forward, we have research that shows why that might have been a possibility in that causal relationship back there, that there could have been something to that, because we know now that adjustments to the cervical spine increases a reaction of cells and tissue that can increase the functioning of our immune system that we see in the bloodstream. So unfortunately, as our profession moved into like the 1970s, or as we move forward, we wanted to be accepted and be tolerated and be able to get insurance coverage and things. And we kind of sold our soul a little bit to the point that we became known as just back doctors and had to have that diagnosis to get reimbursed and things. And so this is an opportunity to me to kind of get that message out there again, to help people realize that chiropractic is more than just about back pain. It's helping your body function at its optimal potential. So I just wanted to point that out a little bit, but that's probably the biggest reason, is that we want to be there to help serve chiropractically in a safe environment, or in a reasonable and sensible way during these times. So I just wanted to share that with you a little bit. Secondly, precautions that we're taking, change that we've done to protect our patients at our clinic is, we're doing a difference in scheduling. We have a time slot set aside for our elderly and high-risk patients that has been put there in place. We have screenings on the phone and screenings when you come in the clinic, as well as the temperature will be taken after they've gone through those screenings. After that has been done, There's no more signing in. You will be asked to go back to a seat by the doctor's room before you enter, that you can have a seat there until the doctor's done with the next patient, so that again you can pass through there and not have me in a seated position. The other thing we offer too is being able to stay in your car, and we'll text you when you want to come in, especially the elderly. We offer that service too. You'll see a difference when you come in with the chair setting, is they're 6 feet apart, and there's no toys, there's no magazines, and of course cleaning. As always, our staff has always done a wonderful job, but we are doing some things differently and more intensified, and also periodically throughout the day, on knobs and doorknobs and handles and things. So we're seeing a difference there. And there's multiple things, I won't list them all here, but again, the staff has implemented amazing policies and procedures during this time. So, and lastly, probably the one I want to spend a little time on with you here is why take a deep breath? Well, it's good for you. It helps cleanse your system and your immune system, and we know that it helps boost your immune system, proper breathing. So just, there's lots of techniques out there, but a simple thing is take an inhale for 8 seconds, hold for 8 seconds, exhale for 8 seconds, do that multiple times, and do that throughout the day. It's relaxing, and there's also health benefits with that. But the big thing about why to take a breath is we need to unplug. Growing up, when I watched TV and the news, my parents in the evening, there was, basically a half hour of the news, weather, and sports. And then maybe a half hour prior to that, we had the national news. And that was it. And they had to get the information, the facts out to the people. There was no opinions. There was no dramatization or can't get the word out, sensationalism of the news like we have today. So, to unplug from that a little bit, because we're getting so much information, it can be overload. I encourage you to go to more resources like the CDC, the World Health Organization. I've got a link at the end I'll share with you. There's some really good data and research that's been coming out now that you don't see on the news, that it's not to downplay what we have, but it kind of puts it in better perspective to let you know there is hope that this will pass. So I encourage you to then take a look at that and put it in perspective. Again, not to downplay it, but H1N1, that year from April 9th, 2009 to April 10th, 2010, 60 million people contracted the H1N1. And I think it was 12,500 people. Now it's just in the United States. We have a long ways to get there. I'm not saying we may surpass that, but realize we didn't do any of these things. So we're on track to making a difference, hopefully, and it won't last as long as we think it will have to last. Let's hope. And also put in perspective the number of people that die from auto accidents and legalized prescription per year. If you look at those stats, they're staggering. And those are some things if we're concerned about death rates, we need to start looking at some of those things down the road too. But secondly, take note of what you have and can learn from this experience. Encourage you to have your children, take their time to have them journal what's going on. This is something hopefully we don't see for a number of years again, so they can learn from that. I'm sure they learned some difference in hand washing and not touching your face. All those things have been in the news, that a lot of things we take for granted. Some of the things we've learned, I'll back up a little bit. And a good opportunity to teach your kids the difference between wants and needs too. I had a guy on a webinar the other day talking about that, and he says, have your kids, if they want something, say a video game to play today, you'll tell them they can play it, but they got to hold their breath during the time they're playing it. And pretty soon they'll understand that they're going to need oxygen. They may want to play the game, but they're going to need oxygen. So they learn the difference between wants and needs. For us as an office, it's given an opportunity to communicate more. We put more policies and procedures, steps and systems in place that we've been wanting to do. It gives us an opportunity to do that because of what we had to get done in such a short period of time with that massive action that they took. The other thing that we've done is this recording. I've been wanting to do something like this for a long time. It pushed me to pursue that, and hopefully we'll do more in the future. And if they turn out okay and you enjoy them. The other thing I want to kind of end up here is finally be grateful. We live in a wonderful small town of Madrid, and I've seen some wonderful gestures being done. We've had the networking of some people helping the elderly by getting their groceries, and even asking me. I had an individual in our community ask me, they're going to be doing, Doc, is there anything you need? And there was a few things that they were able to pick up for me, and I'm very appreciative of that. And you just don't get that in the big cities. And so, it's just time to reflect and be grateful for what we have. Also know of an individual that put a large sum of money into one of our businesses for future use, and he just did it this time because they're going to be struggling the next few months, a possibility. And so things like that, it blesses me, and we just need to be grateful for that. And the other thing I just want to encourage you to do is you have a choice. Like I said, you can do nothing, you can You can retreat, you can take average action, you can take massive action. And one thing I encourage you to do is take some massive actions and reflect about where you're at as an individual in your health. Eat right, exercise. Let's, take your vitamins, take your vitamin D. There's a lot, we know that it can help your immune system. Research those types of things. Have questions, call me. I'd be happy to talk to you about that. We've had that sheet that's out there, talks about how to build and help your immune system. I think it's important we take massive action to make a difference and take this time to learn from this, because an individual from MIT came out the other day and said, yeah, we have to be concerned about this particular bug and the disease. That's fine, but we got to start looking at the host. Why is it in a setting of 20 kids in a daycare, 5 get sick and 15 don't? It's the body. What can we do to boost that immune system? That's something we really got to looking at. And some of that comes from things with how our lifestyle and how we live and stuff, and things I shared about chiropractic today. I encourage people. I think that's more important than buying toilet paper, is to get an adjustment. I know that's going to help your immune system. So that's not the purpose of this, is to tell you need to adjust, but I think it's important to understand that is an option. It's something you can look at in the future for your wellness of your family. So, and lastly, I really want to challenge you that for every day, every time you pick up the phone and look at the Facebook or your social media, or turn the TV on to watch the news, if it's the next 30 to 90 days, I always say a 90-day habit's a good thing to develop. For the next 90 days, every time you do that, take the time to read Psalm 23, read Matthew 11, 28, 29. I learned that from watching a sermon last Sunday on TV, and or actually on my social media, and it was a wonderful sermon. But those are some words of wisdom and gives you peace during this time that I just challenge you to do that for 90 days. And also at the end of this, if you're interested, there's a link, there's a prayer there that I saw about connecting. And I think that's appropriate at this time when we're disconnected with respect to friends and family and things like that. However, it's a good opportunity to reflect on how important it is to connect with our loved ones. So with that, I want to wish you all well and health. And if there's any questions, please contact me. My cell phone's available. I'm happy to put it out there. So any of our patients have any questions, want to contact me direct, feel free to ask Dee Dee or Deb or any of the staff there to get my cell phone number. I'd be happy to talk to you. So have a great night, and we look forward to seeing you soon. Thanks.